Good morning, good afternoon, wherever you are. So good to have you here. I don't know everyone. I wish I did know you all better. I'm Susan Reinhardt, Senior Vice President and Director of the AARP Public Policy Institute, where I serve as Chief Strategist at the Center to Champion Nursing in America and Family Caregiving Initiatives. That's a mouthful, I know. But more important, I am joined by my colleague, Dr. Piri Ackerman-Barger, who is a Senior Health Equity Fellow with us at the Future of Nursing Campaign for Action. But she's got other things too, like all of us have many different hats: Associate Dean for Student Affairs and Health Equity, Diversity and Inclusion, and Clinical Professor at the Betty Irene Moore School of Nursing at UC Davis. And Piri is actually going to be the star who facilitates this webinar. So I'm really happy about that. Let me just say a few words before I turn it over to Piri. First of all, just thank you. Thank you for joining this webinar. We're calling it Advancing Health Equity Through Nursing Pathways Programs. You can see that on the PowerPoint right there today. And we're going to be learning about innovation programs that are really happening around the country. And Piri has been working with us to form a learning collaborative around this, as well as running one herself. And it's all about bringing healthcare career opportunities to communities that are underrepresented in nursing and other allied health professions. These programs, we believe, offer both economic opportunities and earning power to the individuals, but also strengthen the entire profession, helping to diversify the healthcare workforce and bringing what we really, really need, much more capacity for healthcare today and into the future. So there's a lot of interest in these programs. A lot of interest. Whenever we talk about it, people want to learn more about it. So today we're really happy that we're going to hear how these programs work, what their outcomes are, and lessons that they've been learning already and continue to be learning about. But we're going to have time for you to ask your questions. And our hope is that these models will spread across the country for both people considering careers in nursing, but in healthcare and allied health in general. Most of the programs you hear about today, though, are funded by the AARP and the Robert Wood Johnson Foundation through something we call the Health Equity and Nursing Innovations Fund, which is at the Center for Health Equity Through Nursing. So a few housekeeping details. These are things that I know you're all very experienced at. First of all, the webinar is being recorded and it will be available on the Campaign for Action website. Please use the chat function to share your ideas, make comments, ask questions throughout the call. And after everyone presents, we will answer the questions that are in the chat, but we'll also be able to have you raise your hand, as you know how to do that now from years that we've been doing this, and we'll call on you. And please keep yourself on mute unless you are speaking. So I'm really excited to get going, and I'm going to turn it over to you, Piri. Thanks again so much for facilitating.
Thank you, Susan. It's a pleasure to be with you all today. One thing I want to say is that the catalyst for this webinar falls under the bucket of health equity. And health equity is an aspirational goal of what healthcare outcomes could look like. And this is a world where people have the opportunity to live their healthiest life possible. So that's a fairly broad umbrella. One of the things that we do know, from the early 2000s is that one of the ways that we can get there is through having a strong, robust nursing workforce and a diverse working nursing workforce. And so the question is, how do we diversify the nursing workforce? Progress has been, incrementally better, but slow. So in terms of action items, a lot of us have had the same thought that pathway programs may be a way for us to encourage people that maybe thought that they wouldn't be a great applicant or never even considered nursing at all. So there are several of us today that are going to share with you examples of our attempts at, our successes, and our lessons learned around pathway programs. And one of the things that you'll see is that there are many geographic locations that are represented, and there are different points in the nursing pathway that we are addressing. So I'm really excited about our speakers today. And what I'll do is I'll introduce our speakers right before each of the presentations. So the first presentation is going to be from Dr. Garrett Chan. And he is the president and CEO of Health Impact, the California Designated Nursing Workforce and Policy Center. He is also associate adjunct professor at University of California, San Francisco, and his scholarship and policy work has focused on palliative care, emergency nursing, advanced practice, registered nursing, scope of practice and education, and nursing workforce strategy and development. He is currently the chair of the Board of Registered Nursing, Nursing Education, and Workforce Advisory Committee. So Garrett Chan, we are excited to hear you present today.
Thank you so much, Piri. It's a pleasure to be here with all of you and also with my co-panelists who are amazing nurse leaders in their own right. And so I'm going to kick us off today talking about the nursing workforce strategy in California. Health Impact, as Piri mentioned, is the California Designated Nursing Workforce and Policy Center. And we are one of currently 42 state nursing workforce centers in the United States. We all belong to the National Forum of State Nursing Workforce Centers. That's a long title. So the National Forum of State Nursing Workforce Centers, who is our coordinating organization. And so one of the things as I entered into the workforce sphere, I wanted to kind of get my arms around what does workforce strategy actually mean? And so my board and I created this infographic, and we're based in Oakland, California. So I'm a native of the San Francisco Bay Area of California. And so you can see the graphic has the Golden Gate Bridge. But one of the things that we wanted to understand and delineate were the key areas that we wanted to focus on as it related to workforce strategy. And so we identified 7 key areas for nursing pipeline and development. So starting on the very left of the infographic is the K through 12 pipeline. We understand, and you will be hearing from amazing, again, nurse leaders today about some of the initiatives that have been going on in the United States, which are really energizing and outstanding examples of how we can engage the K through 12 population to think about the health workforce and specifically nursing. We also have to think about prerequisite education and pre-nursing pathways. So how do we actually get people ready for the health professions and specifically nursing through prerequisite education? How do we smooth that pathway? How do we have many different schools of nursing all agree on the exact prerequisites so that a person who's interested in nursing can take those prerequisites and be prepared to enter into multiple schools of nursing? Should they receive multiple offers to enter into the school. We also have pre-nursing pathways. So many folks are engaged in allied health professions. We're starting to see in California specifically a significant increase in community health workers and peer counselors, but also the traditional allied health professions like emergency medical technician, certified nursing assistant, doula. How do we help smooth those pathways for those individuals to get into the licensed health professions? Then we enter into the pre-licensure education sphere. So at the nursing RN, LVN, LPN, as well as, oh, sorry, previous slide, please. The RN, LPN education, as well as the advanced practice nursing education sphere. There are lots of issues in this particular area, things like faculty shortages, clinical placement opportunities. How do we use the latest neurobiological and learning sciences to facilitate, really connected learning experiences? And so pre-licensure education encompasses a lot of different issues, as I mentioned, but really important to, and currently one of our major pipeline kind of narrowings to get people into the professions. Once they graduate from their programs and they pass the national board or national certification exam, and they go over the Golden Gate Bridge on this infographic, and then they enter into the workforce. So starting at the 6 o'clock position, we have the upskilling the workforce key area through either academics, like academic progression in nursing, as well as through mentoring programs, either through transition of practice programs, residency fellowship programs, or apprenticeship programs, or just through mentoring. We need to help upskill the workforce so that they can meet the challenges of the healthcare environment today. Moving towards the 9 o'clock position, we talk about innovative models of care. Now in this post-pandemic, we're seeing a significant rise in telehealth and virtual care, and how do we prepare the nursing workforce for these particular types of innovative models of care. Going towards the 11 o'clock position, we talk about and focus a lot of efforts on retention, health, and well-being of the workforce. These professionals, do a lot. They have gone through a lot. They've expended a lot of resources, time, and energy to get into the health professions. So how do we help retain them in direct care positions? Because in the United States, while we talk about the nursing shortage, we actually know that it's not necessarily a shortage of licensees, but really it's a shortage of direct care providers. People are leaving these direct care positions and seeking employment elsewhere. So how do we help retain them in direct care positions? How do we focus on the health and well-being thing and address issues like burnout, moral injury, moral distress, and things that we don't talk about enough, which are also nurse suicide. So what are some of the things that we can do to improve the health well-being of the workforce? And then the seventh area is kind of at the 3 o'clock position, which is workforce migration. What we know is that there's a great migration of clinical staff in direct care positions, at least in California, but also in other states where they're educated in perhaps the metropolitan areas. It's hard to find new grad positions, so they'll go to more rural areas of the state. They'll stay for 1 to 2 years and get their experience, and then they move back to the metro areas. And so this creates great instability in our rural, more under-resourced areas. And so we need to figure out how to, quote unquote, grow our own so that people who are living in those communities will get educated and then stay in those communities. So what we're starting to see, at least in workforce writ large in nursing specifically, are foci, the 7 foci, and people doing extraordinary work across the country. So on the next slide, I just want to briefly talk about some of the focus. What are some of the foci on pathways? So one of the things that we see is that there's an increased awareness of the health professions as a potential career, and you're going to hear more about that from the other panelists. We're also focused on increasing access to educational opportunities through financial means, through scholarships, loan repayments, things like that. We're also focused on providing supports to first-generation students so that they can be successful in their educational pursuits. We think about wraparound service supports. What are some of the things that need to go into helping this person succeed in their educational program? Things like dependent adult or dependent child care, things like transportation. All of these wraparound services are incredibly important. How do we pay for things like, let's say, the NCLEX exam fee so that we can get these people into the profession? There's great need in these wraparound services, and you're going to hear more about that later today. I mentioned earlier, how do we smooth pathways to advanced certifications and degrees, things like stackable credentials? How do we ensure prerequisite or pre-nursing education is connected to nursing education? So one of the things we're hearing a lot about in the United States is that people will take these prerequisite courses, they'll pass the exam or they'll pass the course, and then they put it aside and they never think about it again. But the reason for these prerequisite courses is to help improve and set them up for success to learn about nursing and the health professions. So we can't have disconnected learning, thinking they learn something and then they can pass the final exam, get a grade, and then never think about it again. We unfortunately, what ends up happening is that's what goes on with these students is that when they get into the pre-nursing or their nursing education, they have to think back, what is the action potential of cells again? I did dissect a frog leg, but I actually don't remember what that means and how that connects to health. We know in cardiology specifically, as an example, that action potential of cells is incredibly important in understanding dysrhythmias of the heart. And so we need to connect these concepts together so they understand the importance of what they're learning in these prerequisite courses to health and well-being. The last thing that I'll mention for focus on pathways is how the educational system either supports or does not support creativity. We know that in nursing, there's a huge initiative within the American Nurses Association, as well as the Johnson & Johnson Foundation, to focus on innovations and how can nurses really improve the health and well-being in these new, innovative, and creative ways. And there's a very landmark study by George Land, who, and I have the link here, where he studied 1,600 children who were 4 or 5 years old. And what he found is that the concept of creativity really decreases as we grow older. If you can go to the next slide, please. There's a graph here that shows this concept of creativity at the genius level. What we see is that when we're 4 or 5 years old, 98% of the 1,600 children that he studied really scored very high on creativity. And then what ends up happening is that we get them into the educational system, and the educational system tends to focus and kind of have people conform. What we see here is this drastic reduction in the creativity scores at the genius level at age 10, at age 15, and then only 2% of adults in his study, because he did this longitudinally, scored at creativity at the genius level. And there are 4 kind of key issues that I would like to just point out. We need to move from the concept of instructionism to constructionism, which means moving more from, telling people what's in the book to how do they construct their world around them. How can we move from convergent thinking or converging so that we're all thinking the same thing to divergent thinking so that we're thinking creatively and creating new ideas? How do we move from information recall to imagination? And how do we move from content to skills? So I just wanted to share this overview of thinking about the workforce pipeline and how do we support the next generations of nurses who follow after us. So back to you, Puri.
Wow, Garrett, thank you so much. I am remembering sitting down with you a couple years ago at the American Academy of Nurses and you showing me the infographic and my mind being blown. So I'm really excited that you're able to share that with us today. And one of the reasons I think that visual is so important is that I hear people trying to figure out where's the best place on the pathway to make a difference. And really what I want to say is that there are so many different places on the pathway to make a difference. Like it's not a competition. There's not like one spot that's more important than the other. It's that there's a lot of work to do and there's a lot of space to do it. Garrett, thank you so much for talking about divergent thinking. I mean, this really underscores why a diverse nursing workforce is so important, that we need that diversity of thought to create that divergent thinking. So let's start exemplifying what Garrett said was the extraordinary work that we see across the country. So our first presentation is going to be by Dr. Martha Dawson, who is Associate Professor at the University of Alabama at Birmingham School of Nursing. She is also the past president of the National Black Nurses Association. She is the founder and PI of the National Black Nurses Association Mini Nurse Academy, which we're going to hear about today. And she has created multiple nursing pathway programs with over 5 million in HRSA funding. So Dr. Dawson, I'm going to hand it over to you.
Thank you, and good afternoon, everyone. I'm excited to know that you're joining us today, and I'm going to explain a program that we started as a pilot program back in 2018 in Birmingham, Alabama, with an elementary school, and then we followed that up with a second school. And then in 2019, we decided to elevate this to the national level, and this is referred to as the Mini Nurse Academy. It's the MBNA Mini Nurse Academy. So rather than talking so much, I'm going to let them go ahead and play the 5-minute presentation, and then I will walk through the slides. Can we have the volume with it?
Yeah, we're not getting the sound, Geneva. Can you restart?
Okay, let me see if I can restart it and see if the sound will come through. Okay, since we don't have the sound, I would say let's just continue with the slides then. And maybe after that, we can come back and see if we can get the sound to come up. So the Mini Nurse Academy, as I stated, we did 2 pilots within the Birmingham area. And then after that, we brought it to the National Association. And bring back up the slides. One of the first things we decided to do was to come up with a logo for this particular program. And the logo is "A child educated is a family elevated." And since we formed that particular logo, now we have expanded that somewhat to include that a child educated is a family elevated, is a generation liberated, because we do believe that having a very strong foundation is extremely important. Next slide. So just to kind of give you an idea of how we kind of emerged into this, we actually have the program patterned after a sport immersion program. If you look at any sport where any child excels once they become a teenager or adult, everything started while they were a child. So if you probably have a daughter, they probably started dancing or cheerleading or something, gymnastic at a very young age. And of course, we know with the young boys, they also start at a very young age. I know for myself, my nephews, they were saying ball before they could almost say daddy. And everything that was round was a ball. And we know that we start all of our kids off very early in different sports. And they have a tendency to gravitate towards what they enjoy, and then they begin to excel in those particular sports. Our curriculum is an academic curriculum. We had a committee that came together, and they actually developed the different modules that we actually teach. The program really goes into elementary schools, and we are working with children that is in grade 3 through 6. And we deliberately decided not to just go with just one class, but we wanted, again, to make sure we had students at different stages within the educational program. So hopefully they could challenge each other. Again, some of the information that we was reading was, you put kids together on a football team, and the younger kids going to try to keep up with the older kids, and the older kids are going to really try to make sure that the younger kids can't keep up to them. So it's a very nice, I would say, platform and model to encourage each child to excel at their own pace, but at the same time have a challenge and a goal to reach. So we usually start in the fall when schools open. We have to have a memorandum of understanding signed with the school. And we don't select the students to participate, but the faculty members at each school work with the students to bring them into the program. And so far, we've been really lucky to have a good mix of students, both in terms of male as well as female. There are 3 content modules, and these include class discussions. We bring in speakers that are nurses. We have different presentation. There's a lot of interactive activities that they're able to do. There's a lot of peer learning and peer sharing. And then we have those role models to come in and actually talk about their career journey. And we give them some history as well about having nurses from different races and ethnicity in our field of practice. At the end of the program, we do a graduation. Parents are able to attend that. We have the students to do a small project either individually or as a team, and they present that during their graduation. And then follow-up period where the chapters really maintain contact with these kids. We have what we call pop-up mini nurse academies during the summer sometime. And we may work with the Girls and Boys Club, or we may be working actually with some of the, I would say, summer programs that are in their city right around the corner where they're living at. And then we also invite them to our national conference and our local conferences as well to keep them engaged. The next slide. So these are some of the things that we actually talk about. We talk about the different disease processes. We talk about, you know, what is the impact of poor education? How can that affect our health? We talked about the affordability or the lack of that affordability of health insurance. We also break things down into small departments so they can understand what is the difference between maybe a med-surg nurse or ICU nurse, or a nurse working in the ER or working with pediatrics or babies. We also bring in those advanced practice nurses, nurse practitioners, nurse anesthetists, and also faculty members. We've been really blessed to build some relationship with our schools of nursing, that some of the senior students now are using our school sites as a part of their leadership courses. And in addition to that, we also have some of the kids now where the schools of nursing are opening their simulation lab. When we develop a memorandum of understanding with the school and the principal and the faculty there, we ask for a single classroom, and we actually outfit the classrooms so that we have what we call a mini simulation lab present within the school. That means they have skeletons, they have blood pressure cuffs, they're going to have anatomical organs, they have child appropriate mannequins. And one of the things that we really enjoy is having them to go through those interactive exercises. For example, we would teach them how to take their blood pressure and their heart rate pre and post exercise, so they can really see what happened when they're out running and exercising, how their heart rate goes up and then how it comes back down once they. This is actually one of the principals here with the graduating class. So when the students graduate, they all get their white coat, and they also get a pin by the nurses that have been working with them. Next slide. So these are some of the demographics from our first year when we actually was working with students. So you can kind of see in terms of rural, we was one school, we had 10 that was considered in the urban area and one suburban school. We did 2 pop-up camps, mini nurse camps, and currently we have 12 schools. Our target by the end of this year is 14 schools. You can see here in the center location, you know, this is the breakdown of the race and ethnicity of the students at this time. And I think we have a pretty good mix in terms of 45% of African Americans are defined as Black students, 5% Asian, and 10% white, and then we have about 32% Hispanics. So a good mix of individuals. And again, we talk to them about age-appropriate things, but we also teach them about the aging process, because many of them may be actually living with their grandparents or others. We also look at such thing as talking about homelessness. We talk to them about unstable and crowded conditions. During COVID, we actually had our faculty members that was actually invited by one of the schools to actually just join the class via Zoom. We didn't do that with all of us, but we did it at least with that one. So next slide, please. So some of the lessons that they're learning how to plan their time, how to be flexible, how to work as a team and in partnership. At this time, we are also learning a whole lot about funding ourselves in terms of reaching out and being able to sustain the program. So we've had corporate partners that has participated with us in terms of fundraising. We've been able to get funding from Direct Relief, and that's one of the reasons why you see their logo here. There was one of our earlier funders, and they support us. We've had conversation also with Ms. Johnson at HRSA about how can we start considering these pre-nursing programs as funding for HRSA grants, because I firmly believe that you have to embed something into a child early in order for them to envision what they can be and what they can become. So there are some administrative and legal things that we've had to work through. Again, we have to get approval from the school. We have to have a memorandum of understanding signed so that all of those legal responsibilities are taken care of. We have to make sure that when we're with the kids, there is another school employee with them. So it's just not our nurses with them. Next slide. Okay, can you go to the okay, that's the end of that one. Okay, so just to give you a couple of states that we're in at this time. We are in Oregon, we're in California, we're in Florida, Alabama, Chicago, we're in the Philadelphia area, we're also in Virginia. I'm sure that I'm missing one or two states that we're in. But again, the nurses are very excited about this program. You can find out more information, and I apologize that the video did not play, but you can find that video if you just go out and just put in MBNA, Mini Nurse Academy. You will see videos, you will see the documentary, you will also see articles, news, things that we've been on, several news programs all around the country. So the program is growing, hope it grows even more. So thank you all very much.
Thank you so much, Dr. Dawson. That was amazing. What we would like to do is we'll post the link for the video and post the link for the Mini Nurse Academy for those folks that would like to see a little bit more. And again, we really appreciate you, Dr. Dawson. Next up, we have from the Brandywine School District Lifesavers Program. This is a middle school program, and it's going to be presented by Beth Maddie. Beth is the coordinator of the BSD Lifesavers Program in the Brandywine School District in Wilmington, Delaware. As a longtime school nurse, she and her fellow school nurses identified an opportunity to engage students with their own school and introduce them to a career in nursing. Beth is the co-lead of the Delaware Nurses Action Coalition. Beth, take it away.
Thank you, Perry. And I am as well pleased to be here among all of these and hear about all of these wonderful programs. I have a video that we're going to share once Jen gets the slides up. But we started in 7th to 8th grade with middle school students, and then we added 9th and 10th graders last year. We started with 30 programs. We found that we can handle 10 students per school. But so we have 3 middle schools and 3 high schools in our district. So we could handle up to about 60. We have about 50 people. Jen, do you have the slides?
Yes, Geneva is showing them
Okay,
on the screen. Can you see the screen?
no.
Can others see the screen?
I can see the
Yes.
screen. I've got the video
Yes.
going.
And the videos.
Oh,
Yes.
okay. All right, I can't see it. I
Mm,
wonder why.
no.
Oh, maybe it's up here.
I can't see it.
No, I can't see it. It's on Jen's.
Geneva's casting.
I'm sorry, Geneva.
Yeah.
I'm sorry, Geneva.
That's okay.
If you go to the
Everyone's-
top
can
You
of
ready
your
for her to
screen,
now? Can everyone see it now?
No.
go to the top of your screen and there's a
No.
little square box that says view, and it should be able to change what you're seeing on your screen.
Okay.
It maybe
There
because
we
that's
go.
the
There it is.
spotlight.
There it is.
You got
There
it.
it is.
Great. Okay.
Okay. So you're gonna go ahead and play.
Yes, absolutely.
Okay.
Right on the baby stir. There you go. 1 and 2 and 3 and breathe. Now, yep, overlap each other a little bit. Right on the baby stir. There you go. 1 and 2 and 3 and breathe. 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 Good. 1 and 2 and 3 and breathe.
You can just help hold aside. See this one? Yeah. That's very good. Worry about their appearance, their pulses, their grimace, which is basically their facial expressions.
The relationship with Brandywine School District, one is we couldn't do this without the school nurses.
So every vital sign has a certain number, but Brady always means less than.
Where they're actually doing most of the teaching part, teaching these students information that they need prior to coming to.
Beth, you need to unmute yourself.
Okay, now can you hear me? Thank you. I think that shows you the hands-on activities that we really engage our students. While we still have the didactic and we teach them the basics, we really want them to be engaged. In middle school and high school students, that's what they really enjoy. They really enjoy this collaboration that we have. And that's what really is the strength of our program. Number one, we have the school nurses in the schools recruiting the students that we can bring in, but the collaboration between our community partners is huge. The Christiana Care Health System, the University of Delaware College of Nursing, and our Division of Public Health also we have used as partners where our students can go into the community and learn about that type of nursing. what we have added this year and what we're trying to grow is our mentoring program. We're having our advanced students work with advanced nurses from Christiana Care to just work on skills, just skills and hands-on, and just what do nurses do. We did bed making last week, and tomorrow, next, they've done other things like catheterizations with a sterile procedure. So it really just skills, but it's a hands-on activity that they really like. But we're trying to establish that relationship with those nurses so that they do have somebody they can reach out to when they're thinking about where should they go, what should they pursue. The other piece of this is that both of the Christiana Care and the University of Delaware have summer programs that we can connect our students to. So that also is something that has really been important for us to develop. So then the next slide. And this is one of the things that we're really excited about. We have a donor who has wanted to establish a scholarship program for these students that have gone through our program. So this is the first year. We're not going to have anyone for another year, anyone graduate that we can award the scholarship to, but any of our students who have at least done 1 year in our BSD Lifesavers program will be eligible for a stipend. It's not a full scholarship, but it's money that they can use towards their nursing education once they've matriculated into a accredited nursing program. So we're real thrilled about that. So if we go on to the next slide, lessons learned. One of the things, we are very fortunate because we are in the schools and we can reach out to the students, but we have to reach out to them. Just because we say this program is available does not mean that they're going to come. They may not see themselves as being able to do this program, or maybe it's not something they've ever seen that they've been able to do. So we've really worked with our counselors and our AVID teachers. AVID is for students learning, first generation college students that learn the skills that they need in college. We reach out to them to help us recruit students that have shown potential, that may be interested in pursuing a career in nursing. And we've been full, particularly in the middle schools. The high schools, the after-school program interferes a little bit with their after-school activities, and we require that they come to our 10-week program. But we've been able to get at least 8 per high school to attend the program. The other issue that we have faced, and I don't know how others with a similar program have done this, but transportation. It's been difficult to get bus drivers, and our transportation has really, really, really been supportive. I see you nodding your head there, to get that transportation, because we're going after school to a program, and this is the time that kids are being dismissed from school. So it's been hard to compete to how do we get the buses to take our kids there. And it's always a little bit of a struggle, but our transportation department has just been so supportive of the program. The other issue that we face, and I've talked to people around the country, is how do we scaffold? How do we scaffold the program? So we've got anywhere from brand new students up to right now, just 3, because this is our 3rd year of our program, but up to year 4. How do we build on what they've learned the year before? Each year we have between 10 and 15 students return. And how do we keep them engaged with new curriculum, new ideas, new opportunities, while still addressing the new students that have never been in the program before? How do we keep them engaged as well? So that's been one of our lessons learned, and how do we do that? And if anyone on this has some ideas of how they do it, I'd love to hear that. But we've been very pleased and very successful, and we're looking forward to continue our program, and we have great support from our community and from our district administration. And that's it. That's what I have to say.
Thank you so much, Beth. That was amazing. A lot of things were resonating on this side. The importance of having the nurses and the mentors to reach out to. I actually had a student that just reached out to me, is applying for college, and said, I'm being overwhelmed by imposter syndrome. And I was like, we need to chat, right? So those relationships are so important. And we've had similar roadblocks to not use a pun, but transportation as well on our end. So thanks again. And next up is the Summer Health Institute for Nursing Exploration and Success at University of California, Davis. And I would like to introduce Patricia Fernandez. She is a K through 12 educator with a master in the art of teaching from USC, and she serves as the assistant director of the UC Davis Shines program. She does that program with me. She's currently a second year PhD student at UC Davis Betty Irene Moore School of Nursing, and she brings 8 years of teaching experience to her impactful role in the healthcare education and pathway program development. Patricia, take it away.
Thank you, Piri, and thank you, everyone. I am really grateful to be here today. I sit here today, I think, as a true testament of pathway programs and their importance, and then the importance of collaborating with educators as well as nurses in order for these programs to be impactful for students. I think that we are siloed in so many ways, but this is a beautiful opportunity to come together and make an impact on our students together. So next slide, please. So Shines is a 2-week summer program that we focus on high school students. And we really are focusing on those students that so many of us have mentioned that aren't quite sure whether they could be a nurse, are struggling with the idea of whether even pursuing higher ed is right for them. Like Piri said, imposter syndrome, it's something that we address in our curriculum for our students. And just the idea of just giving them an opportunity to understand, here's what a nurse does. Here's how I can also support you if you do decide you want to pursue this. Academia can be terrifying for many, especially for first generation college students. And so let me give you some tools, and then let me give you me as a support to help you fill out your FAFSA, get your college recommendations letter. How can I help you as well? And then also thinking even longer term to really get them excited. Let's practice our interview skills. Let's practice building a resume, and let's talk about how we can present ourselves in such a manner that can really convince the others that I do belong in this community. I belong as a nurse. And we are super excited to begin offering work experience for our students and or certifications. We're also going to be offering CRNA, am I saying that correctly? This is the non-nurse. Certification, CNA, thank you, Piri, I apologize. CNA certifications, doula certifications. So we're just giving them opportunities to kind of dip their toe in the world of healthcare. Next slide, please. So we have 2 years of data so far. Shines has been in existence for 2 years, and we've done a pre and post survey in order to just help solidify that we feel confident in our impact that we're making on our students. So through a Cohen's D, we have confirmed that we have made an impact. Our students are overwhelmingly appreciative of these programs. And you can see on the left, the things that have reached the highest rank are, I know the steps that I need to take to pursue a career in healthcare. I can identify resources that will help me become academically ready to apply for college. And I know what nurses do and how their role uniquely benefits patients, families, and communities. So these were our highest ranked in our survey. And it is just really reassuring for Piri and I, as we have poured our hearts into this program, to know that our goals are really, they're coming to fruition for our students as well. Next slide, please. So curriculum, this was definitely something that we have played around with over the last few years. And these are just some highlights, I will say. One of our biggest things is that we do, at the end of the 2 weeks, our students receive a CPR certification. We also offer them 2 days in our simulation lab at the School of Nursing with nursing students and nurses from the hospital guiding them through different simulations. We have a really fun speed mentoring day, kind of like speed dating, so that the high school students get to understand the wide variety of options to become a nurse. That is something that Piri and I have realized. I think that there's a very one vision that I think so many high schoolers or students in general have in mind of a nurse. And until you get to talk to the wide variety of options in nursing, you don't even understand that the options are limitless. So this is a huge, this is hugely popular. We also have them do a service project focusing on the social determinants of health and health equity. So we dive into what social determinants of health are and help them understand how they can make an impact. We do a resume writing, and we have them practice interviews, interview skills, as well as then at the end of our program, they do interviews with other nurse managers in the hospitals. So just to get that experience for them. They also get to tour our mobile clinic that we have at our School of Nursing. And then we have them meet with our local community college representatives to help review their transcripts and really ensure that they know the path, whatever that path is. We know that there are many avenues to becoming a nurse, so that they feel confident in pursuing this as an option for them. Next slide, please. So our biggest lessons learned is definitely our cohort size. More is not always better. Piri and I started our first year with 36 students, and so many people were so excited about it, and we had so many applicants. They said, oh, let's go more. So we accepted 52 our second year. And let me tell you, 52 high schoolers and 2 adults is quite an experience. And we learned very quickly that although it was a fabulous year, you really didn't get to know the kids as much. There's 50 of them, right? So we definitely decided that 35 range is perfect. You get to build a relationship with most of the students and really get to understand how you can support them individually when there's less of them. And of course, funding is huge for pathway programs. We have kind of just been powering through grants to kind of keep our program above water and sustainable. But I, as a PhD student, this is my research. Pathway programs, nursing pathway programs are my research. And the literature even tells us that a lot of pathway programs struggle in this area. And it's really something that we are trying to solve. It's something that we'd love to, a continued conversation that we'd love to keep having. Next slide, please. So some of the promising practices is we've cleaned our curriculum a lot from year to year, and even more so for our third year. We've really identified what benefits the students best from their feedback and the surveys that we've given them. So we feel confident in the curriculum that we have now. We've also had the most incredible success with bringing in our community volunteers. So we hosted about 62 nurse volunteers throughout our 2 weeks last year. And the impact it had on our students is, of course, huge, but the impact it had on the nurses was also incredible. They just loved being able to share their experience with the students and support them, and organically mentorships unfolded just because of the relationships of bringing the community members in. The last thing is something that I shared with Piri at the end of our first year, that really, the more we talked about it, realized this is truly something incredible that pathway programs have to share. And it's this idea of this sphere of influence. We care deeply, of course, about impacting our students and wanting them to pursue nursing, and then also understanding the value that they bring as being a minority or a first generation, that they belong. But by instilling that confidence in the students, the ripple effects that has on the community are incredible. An example that I'll share that I think helps this sphere of influence figure make sense is our first year we had a student, one of our simulation stations was to learn about insulin and then how to administer it and why people need it. Not a super complicated thing. We had a couple nurses teaching them how to give it and then give it an explanation of why people need insulin. One of our students went home and her dad had type 2 diabetes and had to take insulin. And she was telling her dad, like, Dad, I learned all about this. I know everything. And her dad said, I've never learned any of this. I didn't know that's how you're supposed to give insulin. Had no idea. And the student came back and said, like, my dad didn't know and had never been taught properly about ways to administer it. And we learned from conversation that he wasn't really giving himself insulin properly. And his daughter, because of Shines, was able to go home and help him understand that. So just the outreach of that has been incredible. We also have had several parents from our program come to our graduations, hear the incredible speakers, see the impact that Shines has had on their students, and then say, I want to be a nurse. And now we are super happy to say we have at least 2 moms that are currently in prereqs for nursing school. So we focus on our students, and I think it's fabulous because that is, of course, our goal with the Pathway program. But to really understand that although it's just we're focusing on them, the impact is wide for the community. Next slide, please. And I think last up is our video, if we have the time.
Perry?
Yeah, let's go ahead. Well, let's see. Actually, why don't we put that one in the link as well? And we want to make sure that we
Problem.
get our next groups. The video is fabulous, but we'll let you watch that on your own. Thank you so much, Patricia. That was wonderful. Thank you for representing the Shines program. We really appreciate it. Next up is Dr. Andrea Pointer, and she is with Mount Calvary Missionary Baptist Church, and they also have a high school program. Dr. Pointer is an assistant nursing professor for the last 9 years and has also been a staff nurse in critical care, the emergency department, and on medical surgical floors. Her research interests are health behaviors of African American women, the role of spirituality in healthcare, and diversity in healthcare. And she believes that we are created on purpose, for a purpose, and she will continuously strive to make her mark on the world and to make life better for as many as she can for as long as she can. Dr. Pointer, you're up.
Thank you. Can you all hear me okay?
Yes, we
Good. I
can
was
hear
like,
you.
no. Thank you. I was like, play the video. I'm not ready. I'm not ready. No, but thank you guys for having me. Lord, I was writing down so many notes. Those presentations were wonderful. The high school program that I am working on, that I sat and met with my pastor, and I was like, okay, I have this idea where we do some more outreach to high school students. And this was stemmed off of a grant that I received in 2018, but this was focused on college students. And I was trying to, those students that are admitted, I was at a community college and they were there for 3 or 4 years and they still hadn't been admitted to nursing programs. So I was like, okay, how do I catch those students? So when I left the community college and I went to I teach at Belmont University in Nashville, Tennessee. When I got to Belmont, I was like, oh, God, we're trying to get students ready for college while they're in college. I'm like, no, we got to start sooner. So I shifted my focus to go towards high school. And since doing this grant, I realized, okay, we have to go sooner than that. But with my program, it's trying to get students prepared to compete for the rigor of nursing, help them complete it. So we walk them through this process of how to complete that degree or get into a program and help assist them through that. And then the repeat part was getting them to come back for the next group of students to help to then be a mentor or go into the middle schools or high schools. So if you go to the next slide. So with my program, with this development, it was intentional pursuit of diverse student groups. And I was able to bring in Black Americans, African Americans, Hispanic Americans, economically disadvantaged students. So this was my student group that I was pulling from. I tried my best to recruit to get male students, but it was very difficult to get male high school students to come in to this program. The purpose of it was to try to prepare these high school students for future healthcare roles and to bring in a diverse body of healthcare mentor professionals. The intent was also to allow these students to have opportunities to do job shadowing at one of the local healthcare facilities. And they have been able to do that. Community service is also a requirement, because if they are going to be serving the community in the capacity of a healthcare professional, I need them also being able to serve where they get different type of benefits. It's not always a financial, but it's that connection with the people that they're caring for. Also, tutoring services was built into that. So students, part of the program, they had to agree and allow us access to their report cards. So anywhere where they were struggling, because I could ask them if they needed help, and they'd look at me and say, no, I'm fine. And then I look at their report card and I'm like, well, wait a minute. Yeah, we need some help. So with the grant to help pay for tutoring services for students who were struggling in the math and sciences, for those students who said they wanted to come into healthcare, because I know those are areas that are very important when they come into higher education. ACT prep. So the students that I currently have in my program, I'm on my second cohort right now. I recruited for 10th, 11th, and I took some 12th graders, but this second cohort right now, I currently have 10th and 11th graders. They're not thinking about ACT. They're like, well, when the school provides it, that's when I'll take my ACT test. And I'm like, no, I need you to be ready in advance. How about we go ahead and start some practice ACT test, or the grant will help pay for us to go ahead and get this done so we can see where your areas of weakness are so we can get you ready. CPR certification was also in partnership with the local hospital, so that we were able, all of the students that are participating in the program, they do the virtual American Heart Association CPR training, and then the hospital does the hands-on checkoff. So all of the students in the program get to receive their CPR card. And we weren't successful with this with my first cohort group last summer, but this summer I've had 6 students they've interviewed at the hospital. The hospital decided that, hey, we like these students that were job shadowing. They have potential. Like their level of grit is right where we like it to be. We're going to open up high school job internships. So I've had 6 of my students that have interned, who've interviewed at the hospital to do their internship that starts this June and July. If you go to the next slide, please. Some promising practices. College and career monitoring is invaluable. It's something that I picked up. We were having a lot of conversations with, making sure you're talking to your guidance counselor and you're speaking to them. Well, there were a lot of complications because the students that I intentionally pulled from, they didn't have necessarily the best conversational skills starting off. And then there was issues with distrust with their counselors. And even having some of the conversations with the counselors when I received permission going into the schools, they didn't have much trust in the students' abilities either. And I'm like, well, this is where I have to stand in the gap, because I was that high school student who I did enough to just make it through. And I had an instructor tell me that they thought nursing was too advanced for me. So I imagine if that's the feedback, I got it. And I'm still hearing my high school students say that these are things that they're hearing. It dampens their resiliency or their want to drive or push forward. So the volunteers that I've brought in, we're very intentional with feeding into positive, what they can do, why college matters. Even if they don't want to go to college, if they want to go straight into healthcare, that they have different options, that they don't just have to settle. Job shadowing. A lot of these students, the only time they've been in the hospital was to go see somebody die or somebody be born. They've had no other experience, or they see the family member when they come home. So this was like opening a new horizon for them to actually be able to go into a hospital and wear scrubs. Some of them, that was part of the grant, to make sure that we had the students outfitted for what they needed to look like when they went into the facilities. So they were able to job shadow in critical care, in the emergency rooms, on the med surg units. So they were able to follow and watch and see what nurses are doing during their shifts. ACT prep. We worked on making sure we're encouraging that early, and we're encouraging it often. Talking to these students about social determinants of health and what that means, and connecting it to the community service that they're doing, was also very valuable, because we would talk about what social determinants of health was, what it means, but they had nothing to connect it to until we connected it to community service. And when they were out doing the service, it was like, okay, I know what you mean now when you're talking about access to healthcare or economic stability. Like when we would talk about those different things and they would experience it in the community, it made more sense. Something else, recommendations with health programs, CPR certification. with this program being one of the minimum requirements, because it made them feel official, because they're walking around and everybody in their program, they started competing to see who can get their CPR certification finished first. And college tours, we are, during their spring break is coming up, and very intentional with like, okay, we have to go see these schools and these colleges. A lot of them didn't even, we have a community college in our town, so the focus was, well, I might go there, or I don't know, I think I'll take a gap year. I'm like, I don't know what this gap year is, but we're gonna keep moving or progressing unless you go to work. But I want them to see the colleges. I want them to tour these different colleges, universities, even the technical schools, just to show that there are multiple paths into nursing. And I don't want them to limit their options just because they feel like this is the only way they have to go. Some of the lessons that I've learned: there is power in partnership. You might have a dream, but when you have a team, you don't go as far as your dream, you go as far as your team. Because if you are not on the same page, it's a lot of things that I'm able to do, but having the right people in place helps to push that further. So recruitment needed in the schools is important, and having those team members participate, because the students want to see people who are invested in them. We could talk about all day, what we want to see happen, what we like from our offices, but it's like, okay, we have to leave the offices and we need to get to the school systems. We need to be present there instead of waiting for them to come to us. Working on healthcare facilities to try to take more ownership of programs it has been interesting. Currently working on an MOU, and I'm trying to get the hospital to take ownership of this program, because I don't want me to constantly have that need of, okay, I need to have another grant to make this happen. I don't feel like I own this, because I'm like, this is something for the community to help prepare the next generation. So we're almost finished, Lord willing, with this contract with the hospital, saying, okay, we're willing to take this on. And I'm willing to serve in whatever capacity I need to make sure that this is successful, because if the hospital takes this, then the funding will be there. And I put on here, like, your team helps to drive your dream. Like, it's amazing how many people have a similar vision to what you do. There are people who want to see young people succeed. They want to see the next generation get prepared. So it's amazing when you ask what people are willing to show up for. Educational resources for parents are also needed. So my picture here on the bottom, at the bottom right-hand corner, this is one of those accidentally on purpose. I think I heard one of the other programs talk about it. When I was recruiting for the students, I stopped my applications at 20 students, and I keep consistently showing up for each of the meetings. It's about 15 to 16 students. So I've had a total of anywhere from 30 to 32 students in my 2 cohorts. A few of the parents called and said, you know what, I want to go back to school, but I don't want to do like full nursing program. Is it possible to do like LPN? I said, you know something, I got friends. Networking is important. So the technical school, the director of nursing, I called. I said, hey, I have parents that want to go back to school. So the director of the nursing program, one of the nursing instructors, and the director over financial aid, they came to the church. They came to Mount Calvary, and they met with these parents to talk about the application process and what's needed for school and how they would work with the hospital. This past January, the hospital completed their MOU with the TCAP, with a technical program. So they're doing evenings and weekend program, LPN programs, to make sure they can accommodate for these parents that want to come back to school. So, I mean, like, there are so many options and opportunities out there. Sometimes because we don't ask, things aren't happening. Keep the bar high, because a lot of times I think people they feel like, well, these students are struggling, so we need to lower the bar. No, we keep the bar where it is, and you help students to rise to the occasion, because they amaze you every time. It's like we lower our expectations, and I don't know why, because the human body is amazing, the brain is amazing, so they will rise to whatever bar you set for them. So thank you for letting me speak. This bottom, I think it's the bottom left on your screen, this is one of my current groups. This is the current group of students, and about 5 that are in this picture are ones that have been interviewed at the hospital for this internship. So
Andrea, we gotta wrap up. We still have one more speaker.
thank you.
Thank you so much. That was so lovely. I love the pictures. I love the stories. So many things in common. We still have one more presenter. Last but not least, thank you so much, Rebecca, for waiting. This is a group from Meritus Health. This is also a high school program. This is Rebecca Shoemaker. Rebecca is the Director of Nursing Professional Practice and Development at Meritus Medical Center. Rebecca is the program lead for the Nursing Diversity Career Camp, which aims to increase the number of high school students who are interested in nursing and encouraging students to participate in the healthcare apprenticeship program through Washington County Public School. Rebecca, take it away. If we could keep that at 10 minutes, we might still have a little bit of time for Q&A at the end.
Sure, I'll do my best. Well, thank you for
Thank
having me this afternoon. As Sherry shared, I'm from Meritus Medical Center. We're a community-based health system serving a rural population in Western Maryland, Pennsylvania, and West Virginia. And back in 2018, we began examining health disparities in the diversity of our workforce and community, which I think a lot of organizations probably were doing the same thing about that time. Our initial data revealed, you can go ahead and go to the next slide, please. Our initial data revealed that our county population included 24% racial minorities. And at the time, our nursing workforce was only an 8% racial minority. And so we developed some strategies at the time to improve diversity, and we were able to move the mark just a little bit and got it up to about 13% for our workforce, but we obviously still had more work to do. And so we decided to set our sights on introducing the profession of nursing to children in our community. And we were so thankful to have received this grant to be able to help support our Nursing Diversity Career Camp. We targeted 9th grade students in our community. Mostly our target audience was males, those of ethnic minorities, those who were disadvantaged. However, we did open the summer camp up to anyone who was interested. Our objectives were to increase interest in the nursing profession and also to increase the enrollment of diverse students in healthcare related high school programs and eventually nursing programs. Go ahead, next slide. So we partnered with Washington County Public School System in the Career and Technical Education Program, along with our local community college, Hagerstown Community College. Our program consisted of a 5-day summer camp with 2 additional workshop days during their 10th grade year. And by participating in this program, students were able to receive a high school course credit as well as qualification for applying for a medical related apprenticeship in the state of Maryland. And we offered the program for free. Next slide. So our Nursing DEI Resource Council members were a tremendous help throughout the whole process. They were really involved in the recruitment process as well as helping to facilitate our summer camp. Members of our council visited many of the local schools, and they concentrated their recruitment efforts on those schools that are underrepresented, with the underrepresented populations in our community. And we did things like create flyers for the WCPS school system and staff and guidance counselors to help spread the word in the schools. We shared information with community agencies such as Girls Inc. We shared our flyers with our local congregations in the underserved communities. And our Meritus Community Health Team also were a big help in spreading the word in our community. To apply for our program, students and their parents submitted applications along with a letter of intent from the student. Next slide. So our 5-day summer camp was hosted at the Washington County Technical High School, and we conducted that Monday through Thursday, 8 to 3:30. And we also included a field trip to our hospital the following Monday. Students were exposed to various nursing settings and roles. We had many diverse nurses from our hospital who volunteered to help with the camp. They went out to the tech high school and they shared with our campers about their different nursing specialties and their journey to becoming a nurse. Each day also included hands-on skills activities and education. The students were able to get CPR certified and receive first aid training. The field trip to the hospital included a tour of our hospital, And they also received a simulation lab experience while they were here with us, which included a CPR challenge. So they really loved that, getting able to come in and show off the skills that they had just learned to compete against each other. Next slide. So the first follow-up workshop that we brought them back for during their sophomore year was the 2-hour evening program where we invited them to Hagerstown Community College's nursing program. They got to receive a tour of their simulation lab and a presentation about the process of becoming a nurse, becoming a nursing student, what their program looks like, and then also they shared some opportunities for financial assistance. They also got to participate in a vital signs workshop, and we were able to provide them with a stethoscope and blood pressure kit of their own to take home and keep. The second workshop we have scheduled, it's upcoming on May 6th. So they're going to get to help celebrate Nurses Day with us. So they're going to return back to the hospital for another 2-hour workshop with us where we're going to do a stop the bleed training and an Narcan training. And then we have somebody from the school system that's going to come and review the opportunities that they have available to them related to healthcare programs for their junior and senior year. Next slide. So we had 18 students that participated in our program, and the diversity rate was 63%. We conducted a pre and post camp survey to get some of the feedback and the data that we wanted to collect for our program. And the survey results indicated that their awareness, one of the things we wanted to look at was, are they aware of the Apprenticeship Maryland program for the healthcare programs? And so obviously their awareness increased from 44 to 100%. And their interest in the program increased from 66 to 83% as a result of our summer camp. Their interest in participating in the health occupations program increased from 39 to 44%. And those who were extremely interested in becoming a nurse increased by 40%. So we're really excited about that. All the students had a great time, and we got lots of positive comments about their experience. Next slide. We were fortunate to have a dedicated group of team members that were committed to the success of our program. So, you know, in reflecting back on the camp and the program, we didn't really have a lot of takeaways that we would have had to improve for next summer. So we were very fortunate. Everything went really well. Just a few little minor things. So we plan to continue to keep track of them and survey them in the next year or two to continue to track their intent to become a nurse. And so one of the mistakes we made was having them give us their personal email address on a piece of paper, and their handwriting was really hard to read. So we had to go back and do a little recovery there to try to get their contact information to continue to track them. And then also, we didn't spend enough money. So fortunately, we did get approval from AARP to go ahead and repeat our program this summer. And so we're really excited to be able to do that. We're just do a little bit of more of a condensed timeline and make sure we get those additional 2 workshop days in before the end of the calendar year. So that is pretty much all that I have to share about our Nursing Diversity Summer Camp. The picture there on the left is some of our students and some of our nurses. One of the cool experiences that they loved was getting to go into the operating room, and they got to see the robot, the Da Vinci robot, and that the OR uses for surgery. So just wanted to share that cool picture of the experience that they got here at the hospital with us. So, all right, any questions?
Thank you so much, Rebecca. That was wonderful. I swear, if we were all in person, I would be stalking each of you to the lunch hour down the hallway to have a further conversation. This was really great. I do want to open it up if people want to write a question in the chat, or if they want to raise their hand and ask a question. We still have about 11 minutes left. We have one already from Andrea. Dr. Dawson, what is the process to initiate a mini nurse academy?
At this time, we're only working with the MBNA chapters. But if you have a chapter near you, let us know, and we will reach out to them, and they're able to apply for the funding. So we do provide all of the funding to set up the Mini Nurse Academy lab within the school. And we also provide the supplies and, you know, stethoscopes, posters and other things, as well as lab coats and the pendant that we do. But feel free to reach out to me. And if you don't have a chapter within your area, let us know, and we'll work with you to establish one.
Beautiful. Thank you. Beth, I thought I saw your hand go up a little while ago. Was that true?
Yes, actually, it was an accident, but I do have a question that I
Okay.
posted that I would love to see your pre and post survey from Shines. Don't know if you could share that, that would be helpful for all of us trying to evaluate our data.
Yeah, we could absolutely do that. It has been revised a little bit over time, but I think we're getting to where we want to be. We also have a longitudinal survey like Meritus has, where we're checking to see, like, of our people that have participated in Shines, what are their plans?
Yeah.
So, yeah.
That
So
would be
have to
helpful.
share. Okay.
Thank you.
Were there other questions, comments, reactions for the speakers or about the topic today? All right, only the two. Do I see anything else? Oh, Dr. Dawson says they have a pre and post data as well and are following students through junior and high school. That's wonderful. And honestly, I'm hoping that we can collate our data at some point and be able to disseminate it even more broadly than the webinar, because it seems like we've all come up with some really important points and processes that would be beneficial. Great information. Thank you, Margaret. That's wonderful. Um, uh, Jennifer, Pete, and team, are there any final announcements that we want to make on behalf of AARP before we slow down for the day?
You guys are amazing. I do want to just flag the chat. Garrett posted that they're looking for abstracts for an upcoming conference that they're
Oh,
having at the National Workforce Centers. Go ahead,
sorry,
Garrett. You
Jen.
want to put the
I'm
plug
sorry,
in?
Jen. We already have our abstracts selected for the annual
okay.
conference for the National Forum of State Nursing Workforce Centers. And our annual conference is going to be June 17th through the 19th in La Jolla, California, which is near San Diego. And all of the abstracts were chosen according to the key workforce foci that I presented. In addition, we have a category on state and federal policy. We have Dr. Patricia Benner, who's a keynote. We have Dr. Leah Fitzgerald, who is the new Director of Nursing and Public Health at the Bureau of Health Workforce with HRSA. So she's also one of the keynote speakers. We have Dr. Brittany Burke from Kentucky talking about apprenticeship program, transition to practice programs. And we have a panel with Melissa Kleider from the National Fund for Workforce Solutions and Jeff Connor Naylor from the Business Leaders United to talk about funding opportunities. So I put the website in because it's just a continuation of the conversation we're having today.
Great. That's wonderful. Also, we have a hand up and there's another question in the chat, Piri. I just wanted, since we still have time, I wanted to make sure people were heard.
Absolutely. For the Susan, hand
Well,
up.
on the same note as the forum, there's the it's a National Nurse Educator Conference that's held in Colorado every summer, like June-ish. And again, the abstracts for this year have already been accepted, but I would strongly encourage all of you that presented to Google Nurse Educator Conference Colorado and apply for 2025, because I think that it is so important to get this information out that you're doing to as big of an audience as you can. And it's a pretty big conference. It's a national conference that's held in Colorado every year. Thank you.
Is that the Conference of the Rockies?
Let me Google it. Let me Google it real fast.
So there's a question from Dr. McKinney. Are any of the programs focusing on science and math tutoring and the importance of developing these concepts in middle school? That might be a question over for Beth, since you did the middle school group.
Yes, and I answered her a little bit. Yeah, that was in our initial planning, that we want to follow these kids to make sure that they keep their grades up in math and middle school and math and science. And the first part of last year, we were able to do that, but we haven't been able to stay on top of it. And I think that that's something that we need to revisit again, because we are aware of what's happening with the kids, but not necessarily with their grades. But I think that we have the ability to do that, and certainly it's on our radar. But thanks for that question, because it's very important, really something we need to really impress on the kids.
In our
No,
program,
we
the
don't
SHINE
address that.
program, we also are adding in anatomy. And one of our goals is to have students see that the things that they'll be learning in their science courses are very much applicable to nursing. Because sometimes people understand, why do I have to learn chemistry to be in nursing? And if we could really put those pieces close together, we're hoping that we can establish that relevancy and that interest. Did I hear another voice come on just a second ago, or is that an echo?
No, yes, this is Martha. I was just going to say, we're addressing that indirectly when we're doing the labs with the students, as well as when we're also implementing projects with them. You know, it's amazing what, children can actually learn. We, even with the project, we've even taught them information about data, and also how do they cite the data. And surprisingly, at one of the schools, when the student was doing their report out, at the end of every slide, they would say, and this is our evidence. And they actually had it written in APA format. And we thought we was going to fall out of our chairs when we saw that, because besides me, there was a couple of others that were also faculty members. And we were sitting there saying, we can barely teach our students to get APA format right. And they was able to do it. And also just decided, but it's amazing also to see how the parents are supporting the students. So during the summer, when we have health fairs, we ask the parents to bring the students to the health fairs so they can interact with us and see what we're doing in the community. And at one health fair, when the grandfather walked up, he said, I want my granddaughter to take my blood pressure. And so what we did, we took it in one arm, waited a few minutes and let her take it in the other arm. But it's amazing, the buy-in. And someone else mentioned this about the family. The family is so proud of the children, and to see them growing and developing and thinking outside of the box and thinking about their future. And then when the child see that level of support, we've had, like brothers or sisters to come back and say, well, next year I want to be in the program. So there's an interest in it that is not only being spearheaded by the nurses that are working, but the students themselves. And one of the things we do is, when we start the next cohort, we bring the previous cohort of students in and let them talk about their experience. So that's another way we try to keep them engaged as well.
Thank you so much, Dr. Dawson. I think I see Patricia hand up.
Hi there. I was just curious, Dr. Chan, is the conference you mentioned, is it an annual conference, or is this just a one-time conference?
Oh, it's an annual conference.
It is?
Yes.
Okay, wonderful. I just checked the dates and I'm so bummed it's during Shine. It's during our program.
Oh,
but
no,
I'd love
sorry.
to attend. No, that's okay.
It'll be next year in Philadelphia, so keep on the lookout.
Beautiful. Cool. Thank you.
Sure.
This is Susan. I just want to thank Peary. So you did a great job. And of course, all the speakers. But Peary, you always add something to each one. It's so, I don't know, just feels so right when you facilitate. So thank you so much.
Yay. Thank you, Susan. Thank you all. We really appreciate your time, your effort, your attention. And I hope everyone has a blessed afternoon today. Take care, everyone.
Thank you.
Thank
Bye-bye.
you. Bye all.
Thank you, everyone.